Hello and welcome to Chairside Live. I'm your host, Megan Strong. In this episode, Dr. Chi is wowing us with a digital dentistry case utilizing BruxZir NOW. Then stick around because we have breaking HIPAA news that you cannot afford to miss. But first, Dr. Chi is replacing existing PFMs on number 18 and 19 with BruxZir NOW crowns to restore form and function, all while paying close attention to aesthetics. He used a 3M scanner along with fast design software and the TS150 mill for predictable, reliable results. Let's dive right in.
For this case, the patient presents with existing PFM restorations on number 18 and 19, and there is an open contact between the two, which is a cause of a food trap, and the patient would like to have that closed. So we are going to replace these PFM restorations with BruxZir NOW crowns, which we will fabricate chairside. So we will digitally scan the impression, design the restorations right here in the operatory with our fast design software, and fabricate and mill these restorations out with the BruxZir NOW, which is a unique material. The BruxZir NOW stands for no oven weight, so it's the only fully centered chairside zirconia material available today, the strongest chairside material. So we are going to start the procedure by removing the existing restorations. I am using a 557 carbide burr. I find it's quite easy to use to cut through the feldspathic porcelain layer on top, and then carefully cutting through the substructure as well, ensuring that we don't mutilate the tooth underneath. So once we make our depth cuts and ensure we carefully reach the tooth structure beneath, cutting along the buccal, occlusal, and lingual, we can easily use a crown remover to remove the restorations as soon as that structural integrity has been compromised. After the restorations are removed, I'll evaluate the preparations and see what areas I'd like to modify. Both of these teeth are endodontically treated, and they have existing amalgam buildup areas. And after evaluating these, I can tell that these are well sealed and very stable, so I will retain them. I will provide some additional reduction. Here I'm using a round-ended tapered diamond burr to provide some additional reduction on the axial surfaces to about 1 millimeter along the margins. And I will provide some additional reduction on the occlusal as well to ensure that we have at least 1.5 millimeters of reduction. I will bring the mesial buccal aspect of number 19, following the gingival contours a little bit more and placing the margins a little bit more apically and blending all of that in. On the occlusal aspect, once I ensure that I have enough reduction, I typically will use a football-shaped burr to reduce the occlusal and then blending the axial and occlusal areas into each other to ensure that I have rounded internal angles. It's very important these days, especially because most of the restorations are milled, and the milling process uses a round-ended tapered diamond burr to fabricate those restorations. In this case, I use a coarse composite finishing burr to help blend in the axial to the occlusal areas to ensure that I have really nice rounded internal angles in these aspects. Once I ensure that I have the margins reduced to my desired level, about a millimeter, and rounded internal angles and the occlusal reduction is ideal, then I will proceed and provide the tissue retraction for this case. I typically will use a dual cord technique, placing first a smaller cord. In this case, I use a 000 with a little bit of hemodent placed on it. And this first layer of cord helps provide some apical retraction to the gingiva and also some moisture control as well. If there are any areas that I feel need to be reduced anymore, finishing the margins a little bit more after the placement of the first cord, I will go ahead and do that as well. Then the second cord is placed once I ensure that the margins are nice and clean. The second cord here, I use a size 2. Sometimes the larger second cord can be somewhat tricky to place. You may need to push the cord toward the tooth first to compress it, and then move the cord out laterally away from the tooth so that it can seat fully into the sulcus. Here we're using the additional aid of the comper caps, anatomic comper caps, and they will help hold the cord in place and also provides some additional hemostasis as it applies pressure to the tissue around the preparations. After 5 minutes, we will go ahead and remove the second cord, and there is enough tissue retraction and ensuring that the area is well isolated. We are going to utilize the 3M True Definition Chairside scanner, and we first apply a contrast agent. A very, very light layer of the contrast agent helps aid the scanner acquire the information. The camera is extremely ergonomic. It's one of the smallest cameras available on the market, so it's easy to maneuver around the prepared area and the areas necessary to fabricate this restoration. So we start off with the occlusal scans, and I move over number 18, and after the occlusal areas are captured, I have to ensure that I rotate the camera toward the buccal and toward the lingual. A hard rotation, about 90 degrees, to ensure that I capture all of these aspects, and the software captures it very quickly, and I can instantly see as I'm observing the screen whether or not I've acquired enough information. After the preparation scans are complete, we will complete the digital impressions with the opposing scans too. We get the occlusal, buccal, and lingual aspects, and the third set of scans will be the bite to put all of that together. Since I am fabricating 2 restorations, we actually dismissed the patient and asked them to come back after everything was completed. So for about 45 minutes of each milling cycle, we finished both restorations in about an hour and a half. So I'll start off the Tryon. Once the patient returns, it's already gone through the short, low-fusing stain and glaze cycle, about 10 minutes. Once everything's cooled off, we go ahead and try it in on the patient. I start off by trying in number 19, checking the contact between 19 and 20, and ensuring that the margins are well sealed. And then I'll check number 18 individually, checking the margins along the mesial side, mesial and buccal, circumferentially around the entire restoration. We want to ensure that these are adapting really well. And these Chairside materials, the new technology these days, certainly provide great fitting restorations as long as good clinical applications are completed as far as providing the sufficient preparations, reduction, and tissue retraction. You should always get very, very good results. So once each restoration is checked individually, I will check the proximal contacts between the two, and once that's verified, we may proceed with the cementation process. In this case, I will use a resin-modified glass ionomer, 3M's ReliX Luting Plus. So there's no additional conditioners required for the restoration or the tooth, as long as everything is well isolated. And ideally for the preparation, you don't want to desiccate the tooth, but in this case, because they are endodontically treated, we just ensure everything is nice and clean and dry, and we go ahead and mix the cement together. In this case, we use the clicker variety of the ReliX Luting Plus, and after mixing for about 20 seconds and ensuring that the color is well blended together, we will load the cement into the restoration. And here I will go ahead and seat number 19 first, ensuring that it's fully seated and stable. And we'll go ahead and also load number 18 as well. And a unique feature of the ReliX Luting Plus, it does have a tack cure option where you can apply some light cure to it for about 5 seconds to aid with cleanup. In this case, I actually waited the 2 minutes until it begins to gel before I begin the cleanup process. If you do choose to use the tack cure option, keep in mind that if you are placing PFM or monolithic zirconia restorations, the light penetration is certainly a lot less internally, so you're really only accelerating the cure on the outer areas. So be very careful if you do check the interproximal areas with floss or clean those areas out. You certainly don't want to pop the restorations off, which could be a possibility since the internal aspects may not be cured yet. Here we check the lateral excursions. As you can see, the patient's kind of getting their whole head into the lateral movements. And here we are reducing some of the lateral excursions on the lingual cusp inclines of the buccal cusps. Here I'm using a football-shaped burr from the BruxZir finishing kit, just carefully removing any high spots with those lateral excursions. And so within a single day, it wasn't the same appointment because I decided to give the patient a little bit of a break, and it allowed me to finish the restorations completely and have the patient return in the afternoon for the delivery. And I took the additional step of providing some low fusing stains and glaze to enhance the aesthetics a little bit. Here we chose a shade B3, and I added a little bit of B stain along the middle and cervical areas, and also some brown stain right in the primary anatomy on the occlusal to just enhance these areas and add some depth to it, really transform these monolithic materials to a more lifelike appearance and helping it blend into the surrounding dentition. And that's a great aspect to having a CAD/CAM system. It doesn't have to be the same appointment. You can really do it at your own pace. But the fact is we are able to provide a great fitting restoration without any compromise in the aesthetics, very natural looking, and also knowing that I provided this patient with the strongest material available in the BruxZir NOW material within the same day. And we were able to address the patient's problem with the open contacts. Thank you for joining us for this week's Case of the Week, and we look forward to having you back on a future case. Back to you, Megan.
Thank you for that, Dr. Chi. And now we turn to breaking news. The second phase of HIPAA audits are here. Your HIPAA privacy, security, and breach practices might be audited. Then what? What do you do if you receive an email from the Office of Civil Rights? Gary the lawyer sits down with Dr. Neil Park to discuss this very important topic. Don't miss it. It starts right now.
Thank you, Megan. Our topic today is the HIPAA Act. And as all of you are aware, this law took effect several years ago and placed certain administrative requirements on dentists and other healthcare practitioners to protect the security, the privacy of patient health information, as well as to report breaches in that security. Something happened this week that I would qualify as breaking news, and I wanted to get our friend Gary the lawyer, Gary Pritchard, back in the studio so that we could provide some advice and some recommendations to those of you out there. Gary, what was it that happened this week?
Thank you, Dr. Park. Monday, HIPAA started their second phase of audits. And so if you are involved in that second phase of audits, you may have received an email from the federal government.
So Gary, an email from the government. I mean, that does not seem like a normal way for the Department of Health and Human Services to communicate with us. What are they going to do next time? Send me a message on Facebook?
Right.
I mean,
it could be texted. Right.
Yeah, right.
So, no, absolutely. But I think that what they're trying to do is get a broad range of people to respond, and then from there determine who's going to be involved in the audit.
Okay, so it's an email. They need to look in their junk mail box to make sure it didn't accidentally get in with the spam. Right?
That's actually in their advice. It says check your junk mail, check your spam mail because our notice may end up there.
Okay. Do we have any idea how many dentists received this message?
No, we don't. I think the best thing we can kind of look at is the Phase 1 audit. The Phase 1 audit covered 115 entities.
Okay.
So that's relatively small number of people. But now to narrow it down to that, they're going to send out the email to a much greater number of people.
Okay. So they're in Phase 2 of this audit. So if I get this email, and we have a copy of that message that we'll put on camera, if I get that message, what action should I take?
Okay. First of all, what that email is going to ask is, are you the primary contact for the organization that you're working with? I mean, what they're trying to do is get a sample size to find out how effective people are in preparing and securing people's private health information, right? Okay. So they want to get a sample size, and they want to know
different kinds of organizations, right?
Exactly.
So if I'm Neil Park, DMD, then I probably am the primary contact.
That's right.
Right. But if I'm a dentist at the VA, right, then chances are I'm not the primary contact.
Right.
Is
That's
that
right.
how you understand
Right.
it?
And so you would respond, yes, I am the they have two places to respond. Yes, I'm the primary contact, or no, I'm not the primary contact. And then they'll ask you, if you say no, they're going to ask, well, who is?
Okay.
And you need to respond to that letter within the time frame given in the letter.
And the form of that response, what does that take? So you're clicking, as I saw the email, you click on, yes, I'm the primary contact, and then all hell breaks loose, right?
Well, the audits will probably then take place within a couple months of that.
Okay.
So you've got really about a couple month time frame to get your house in order if it's not already in order.
Okay. But it takes you to a questionnaire, correct?
Yes. I believe that it will, but we don't actually have the live link from them. So it might just be yes, and then they follow up. Okay, you're the primary contact. No, okay, now here's another follow-up email. Give us some information about your organization.
Okay. So whenever I get contacted by government authority, which is more often than I care to admit, my first question is, do they have the legal authority to ask me this question, to compel me to respond? What would your advice be? Do they have this authority?
Oh no, absolutely they have the authority. There's another companion act to HIPAA, which is the HIPAA Act, which gives the Office of Civil Rights the authority to conduct these audits.
Okay, so we get this email. It gives us, what was it, 14 days to respond? Days. So your advice is respond within the 14-day period.
Right.
Okay.
Now,
would you say respond immediately or respond on day 13.95?
Okay, that's a good question. I'm going to just say respond within the time frame, but there's no sense rushing your response, right?
Okay.
And everything, like especially if you need to get your house in order, which I think everybody may have a little bit of, or they want to double check and do their own internal audit before you get audited by the federal government, right?
Okay.
So you want to have a little bit of time to do that. So take the maximum amount of time you can if you need to.
Need to. And then I was thinking, well, everybody that gets this email is not going to be included in the audit. Right? They have different categories they want to look at, from the private practitioner to the group practice to the hospital practice, et cetera. So is there any logic to saying, well, gee, the longer I wait to respond, the more likely they filled up that category, and maybe I won't be included in the game here?
Okay, there may be, and then there may not be. Right. So they may wait until, okay, we've told you you've got 14 days to respond. They may just take at the end of the 14 days, take their pool and then randomly select. Okay. And because they want to get a statistic sampling. Okay. And some of it's going to be geography based, and some of it's going to be what type of organization.
And geography as well. Okay.
Right.
So they're really sort of gearing up to learn more about what's actually happening, so they can find out ways to what is the word they use to increase compliance?
Increase compliance.
Okay.
That's what this audit is all about.
Okay.
And that's what the initial phase, the first phase, was about. Now, the first phase only covered the healthcare organizations and the primary entities. This second phase will actually end up asking you who your business associates are. So then they're going, business associates are going to be held to the same standards, same HIPAA standards as you as a practicing
dentist. So just
dentist.
to clarify, part of your preparation, your HIPAA preparations, is to have business associate agreements with certain entities that you work with.
That's right.
What kind of entities are we talking about?
Okay, is there a secretary doing your that you've outsourced to do your transcribing of your records? Is there somebody that you've asked to photocopy your records? It's going to be anybody that's going to have access to the PHI.
Somebody does your billing for you.
Exactly. Somebody does your
billing.
Somebody your CPA, your lawyer.
What about your dental lab? Gee, is Glidewell Lab the business associate of thousands of dentists?
No, specifically excluded from the list of business associates are laboratories.
Oh, so you do not need a business associate agreement with your laboratory?
Yes, they're considered also engaged in the same treatment that the dentist is.
So just to kind of reel back a little bit for our doctors out there, if you haven't really gotten your house in order on the HIPAA side, this is nature's way of telling you that it might just be time.
That
right?
is very, very kindly put, Doctor. Yeah. Yes. No. This is time. And you should be doing this kind of thing at least once a year. You should be doing an internal self-audit and self-assessment to make sure that you're HIPAA compliant.
Okay, and tell me about this process that we should all be going through. I mean, how does it start? Would you say just, go to the library and check out HIPAA for Dummies? I mean, is that what you...
Almost impossible
Okay,
to read this. Okay, I'm going to read the statute and understand what it says, and then I'm going to be compliant. Okay. Almost impossible. No, you need what we call in the legal business poop.
Poop.
Yeah.
Oh, this is another one of those legal terms.
This is a legal term. You need the poop.
Okay.
Right.
And where does one procure the poop?
and that will tell you what to do. And the ADA is a great place to get information.
Yeah. Now here at our practice here, we have purchased the ADA manual and all the materials for HIPAA compliance. And I noticed that one of the first things you do before you develop your whole plan is a risk analysis. And you recommend everybody start with that risk analysis?
Absolutely, absolutely. Get that risk analysis in, and that's just your little internal audit to let you know where are you doing things correctly? Are you going to get this set up correctly?
Okay, and then from there you develop your policies and procedures.
And the great thing about the ADA books is that they give you actually the form policies and procedures that you need for dentists. So it's nicely set up.
And just for our listeners, you do not need to be a member of the ADA to get this manual. You pay a slightly higher price for it if you're not a member, but you can get it as a non-member. It's encyclopedic. It covers everything step by step, and it even provides the training materials for you and for your team, which is a really important part of HIPAA compliance. Is the internal training.
Absolutely. You want to be able to show you've done the training. This will give you the procedures, and this will give you the policies. Then help you with the training that follows up with that. Help you get your business associate agreements in order, and help you get prepared for an audit. Because you can also get audited, of course, or you can have a compliance action if someone makes a complaint about your business.
Okay, so then this would be a patient typically?
Yeah, typically, yes.
That they felt like you did something that didn't respect their privacy?
Right.
Okay.
A lot of times patients will get frustrated. It's very difficult to sue a doctor for malpractice. And this is just another way that they can spin off and try to hurt a dentist.
Annoy you.
Yeah,
right.
No, right.
Yeah, some kind of,
they want a pound of flesh. They want some retaliation.
So the defense is, gee, I have an entire HIPAA compliance procedure that's in my office, and everybody in my office has been trained on this. So if this possibly happened, what this complaint is about, well, it was in violation of our policies, and that's the basis upon which we'll do the investigation. Right?
Excellent, yes, because fines, which we got to worry about, because
right.
the cap on the fine is $1.5 million, right?
Okay, so for a lot of dentists, that would definitely affect the month's P&L.
Yeah,
right?
that could
right.
hurt a P&L.
So why so high? I mean, because I saw it was like $130 if you do something.
Right. Well, these can multiply. So it could be that's per record that you're talking about. Okay. Yeah.
So if you do the same wrong thing over and over,
you've got 10,000 records. 10,000 records were compromised. Take your $230 per record and multiply it by 10,000.
Okay. Yeah, because I saw that an orthopedic surgery practice was fined $750,000, and what they had done was they had sent out all of their patient records to be scanned and digitized by a company with whom they did not have a business associate agreement.
Wow.
Yeah. So that'll.
No, that hurts, right? So or you can I've saw an enforcement action where somebody just leaves a message on a cell phone about the treatment that was performed, and when the patient had instructed them not to leave messages on that cell phone number.
So these kinds of recommendations and policies and procedures, that's what's in your HIPAA policy manual, right?
Right.
Okay, so again, the ADA, I have to commend the ADA for doing a brilliant job on putting together what any kind of dental office, from a solo practitioner to a big group, can use and work forward with to get the policies and procedures that they need.
Right, they've got the poop. You follow their step by steps, and you should be okay. They've also there's third-party companies out there that will come and get your house in order.
Okay.
And so I'm saying when you get this, you have a potential to be audited, and when they complete the audit, if they see enough deficiencies, they can potentially engage in an enforcement action at the end of that audit against you. So this is they're in your tent. You need to make sure you've got your tent in order.
So I saw in the letter there's a mention of of a desk audit versus a field audit? What is the difference there?
Right, and there's really two phases to this. The first phase is that they'll be doing desk audits. So you'll give them information about who you are, then they'll contact you with audit information, and you'll send them documents.
Okay, so they're not going to appear in your office?
No, not
because there's nothing that warms your heart better than seeing 6 guys in black suits pull up in a government car.
Yeah, and I don't want to don't get too comfortable yet, because the second phase of this second audit is going to be the actual on-site audits.
Okay, so there will eventually be on-site audits. But is the desk audit, is that sort of like a preliminary screening thing?
Well, no, they'll do desk audits and on-site audits. So you don't know whether you're going to be selected, but first comes the desk audit.
Okay.
But that doesn't mean, just because December hits and they say they're going to be completed with the desk audits at that time, doesn't mean that you should be relaxing.
Okay.
Because you can still be they've got your name, and they're going to be coming in and doing some actual on-site audits also.
So even though there's a lot of verbiage in the letter that talks about we're trying to establish best practices and things like that, what they are, bottom line, trying to do is increase compliance. The best way to increase compliance is to scare you. And the best way to scare you is to make an example of some of your colleagues.
Right.
So
that's right.
Yeah, so that's what's coming down here. So the best way to head that off is to go ahead and set up your policies and procedures, do your training. You know, we've all gone through it. We have a practice here at Glidewell Laboratories. We've gone through this. It's not horrible. It can be done. Now, there are some high-tech issues, right, as far as your transmission of electronic information. There are some things that a doctor is not going to be able to do himself, right? There's going to require some IT type of things. What is that all about?
Absolutely. I mean, part of the security aspect of the HIPAA Act. Remember, there's security, there's privacy, and then there's breach notification. Those are the kind of your 3 big legs. But part of the security is making sure that hackers can't get into your files.
Right.
So if you are doing anything online, you need to be very cautious, and you need to make sure that you comply with everything.
Right.
To get that buttoned up.
Exactly, and I mean, there's even a part in there where certain situations you have to alert the media, right? So if you put all of your patient records on a thumb drive and then left it on the crosstown bus, you're in trouble.
Right. That's part of the breach notification.
Okay.
You've now breached the PHI of maybe 10,000 people, and you're going to need to alert. You're going to need to alert quite a number of people to that, and part of that might be the media.
So thanks, Gary. Can you summarize some key points for the doctors in the audience who have received this, or maybe even for those that have not received this missive?
Yeah. Well, I think this is a good time to reflect on the state of your HIPAA compliance, right?
Okay.
So even if you don't get an email, take this opportunity to pretend like you did, and do a self-assessment. And if you haven't started anything at all, a great place to start is the ADA materials that you discussed. And so that's number one. Number 2, don't ignore the email if you got the email. This is very serious. I think it's probably short of panic, but also you don't have to just not do anything and say, okay, well, they want a snapshot of where I am now. No, this is a good time to start really rolling, and you need to make sure that you're doing your audit before they come in and do their audit. And so whether that's getting a third party to make sure you're in compliance, or getting the ADA materials, and yourself trying to make sure that you're in compliance, you need to go ahead and take some action if you've gotten that email. We'd also be interested in hearing from people that got that email.
Okay, great.
And see what their experiences are. We can report on that.
So great advice. Don't panic, but take it seriously and take action to make sure that you're in compliance.
That's right.
Appreciate you coming in on short notice to
Thanks,
discuss this with the group, and hope that this information was of value to everyone. Thanks.
Thank you, Doc.
Thank you, Gary and Dr. Park. Well, that about wraps it up for this episode of Chairside Live. On behalf of everyone here at Glidewell Laboratories, we thank you for watching, and I'll meet you right back here next time.